Alright, greetings to everyone and welcome to today's discussion in medicine. So the stem of the question reads, Mr. Daka, aged 58, and the manager of a reputable bank is admitted to a ward in a disoriented state. Following investigations, a diagnosis of cerebral vascular accident is made, secondary to hypertension. Question A1, it was asking us to define cerebral vascular accident, CVA. Okay, in my definition, I'm saying CVA, this is nothing but an interruption of blood supply to a part of the brain resulting in oxygen deprivation and cerebral infarction, and it is mainly characterized by motor deficit. Yes, that is the definition of cerebral vascular accident. So any interruption or disruption of blood supply to any part of the brain, it leads to a condition known as what? CVA, which is also known as stroke. Then the following question, it was asking us to explain two types of what? Cerebral vascular accident. Yes, it was asking us for the two types of cerebral vascular accident. So what are those? Stroke is classified in two categories. We have ischemic stroke and we also have what? Hemorrhagic stroke. Yes. So when we talk about ischemic stroke, this one, it is a form of stroke that comes in due to an obstruction or a blockage in a blood vessel. Yes. So that blockage could either be thrombosis or embolism. Yes. On the other hand, when we talk about hemorrhagic stroke, this one, it is a form of stroke that comes in due to a rupture of a blood vessel. Yes. So this form of stroke, it is very common in patients with what? Hypertension. Yes. So those are the two classifications or the two types of what? Stroke. We have ischemic and hemorrhagic. Then the other question, which is question B. Question B, it was asking us to mention 5 predisposing factors of this condition. Yes, marks allocated 15%. So the question has asked us to do what? To mention. So what are those predisposing factors of cerebral vascular accident? We have age. CVA is common in individuals that are over the age of 60. Yes. The second predisposing factor, it is what? Hypertension. The third predisposing factor, heart conditions. The fourth one, diabetes mellitus. We could also talk about cigarette smoking and also excessive alcohol intake. These are the predisposing factors to cerebral vascular accident. Then for question C, it was asking us to outline the management of Mr. Daka under the following headings. What are those headings? We have medical management and we also have what? Nursing management. Yes. So under medical management, remember we have talked about investigations and treatment. Yes. So under investigations, we have to do history taking, very important. Physical examination, very vital. CT scan, it is also very important. And we also have to do MRI scan. Yes. So those are the investigations that will help us in coming up with what? With a diagnosis. Yes. How about the treatment? So under the treatment, we all know to say CVA, it is an emergency condition. As such, it is very important that we assess the airway, the breathing, and what? The circulation. Yes. If there are any conditions that affects that, it is very important that we manage them. Yes. Then for the treatment, we give anticoagulants such as aspirin. Yes, and we can also give heparin. Yes, so those are some of the medications that we have to give in what? In cerebral vascular accident. Yes, but the main important thing is that we have to ensure that we do resuscitate this patient. Very vital. For the nursing management, I'm certain we know the usual management that we usually write. Yes. Then the last question, it was asking us to outline 5 points you would include in your information, education, and communication to Mr. Daka and his family on discharge. I always mention to say, when you asked about the IEC, just not to say they have given you free marks, because under IEC we just have to use Dr. PHN. We have to talk about drugs, review dates, preventive measures. We also have to talk about hygiene and nutrition. Yes, those are the points that you have to talk about when you are discharging the patient. Yes, so on drugs, talk about taking the medications on time. Teach them about the side effects of those medications. On review dates, this patient may be given the date to come for a review, so you have to remind them on that. Yes. P, we have to talk about the preventive measures of this condition. I've mentioned the predisposing factors. Yes, so it's very important that you teach them about the preventive measures based on on the predisposing factors. Yes. Then the other thing I've mentioned, it is on nutrition. So this patient has to reduce the intake of sodium. The patient is hypertensive. Yes, so the patient has to reduce the intake of sodium.